Then we are live.
Okay, fine. Thanks. Good afternoon, everybody. Today, the topic of discussion that we're going to have is on about bone health and steroid nutrition. And with autoimmune conditions and diseases and rheumatoid arthritis or lupus or vasculitis, the common concern is sometimes, okay, to reduce your pain or swelling and inflammation and to keep your quality of life better, the doctors would suggest steroids. And the steroid recommendation could be sometimes for a week's time or sometimes for a few months too. And most of the time, two things are of concern here. One is, I think the word steroid brings in a lot of fear within you. There's a lot of anxiety and stress. And probably you might be wondering that I think there is some kind of a big concern or a disease. Okay, so there is a lot of question marks within your mind. So sometimes you might be taking, and the moment you start, because already the word steroid has brought a stress within you, so you're going to carry forward the stress, and I think with the same stress you're going to kind of start with the medications too. And this will kind of lead into many other medical conditions, like you can develop, like I think, decreased appetite. Okay, so say developing other medical conditions, nutritional deficiencies, everything can set in. So the moment the steroids that started, it does not mean that, okay, you should be worrying about it. And this is not that once you get started, you have to take it all through your life. Okay, sometimes it depends based on your medical conditions. So do follow your doctor's advice on the dosage or the okay frequency of the medications or for the duration that has been suggested. But what is important for you the moment you start on steroids is you have to be on the right food combinations and I think correct timings of your supplements. And usually whenever the doctor suggests steroids, they would have also started you on supplements. So you might be thinking why to take the supplements, too many medications. Okay, because sometimes, on the food you would balance, okay, a day or two, maybe some day because of some illness you would have stopped eating the right way. But by taking supplements, you're retaining your nutrition levels. So that's the reason whatever supplements is being advised by the doctor, do continue with them. And exercise is also very important, because when you exercise, your activity levels would be better, your cortisol suppression happens, and that will kind of help you to keep much better, where the insulin sensitivity also will be better. And managing your stress is also very important. And at this time with the steroids, okay, how do you protect your bones? Okay, that will be our point of discussion today. Okay, so let me get started. Okay. So what we are going to discuss is about the medicines and the bones, okay, and what are the absorption dynamics that will be kind of hindering sometimes the nutrition absorption, and sometimes how do you best pair your food, okay, so that the nutrition absorption would be better. And I think managing your stress also at this time, okay, because the gut strength, gut mobility decreases whenever you are highly stressed. So maintaining that gut mobility is important. So managing your stress, and I think importance of supplements also will be discussed. And basically, whenever you have, like, I think this is just for information. Okay, this slide is basically oral tablets. Whenever you are on steroids, that kind of medications will be either prednisone or methylprednisolone or deflazacort or dexamethasone. And these daily disease controls will be done, and it will suppress your systemic flare-ups, basically the CRP levels, ESR levels. Okay, to suppress the inflammation levels, the steroids are advised. And in terms of injections also, it has been administered sometimes. Again, this is also to suppress your inflammations. And sometimes it goes with IV and IM injections depending on the flare of the disease. So any steroid, be it tablets or injections or IM injections, very important is how do you manage your food habits along with that. And the impact on bones is like steroids actively disrupt bone metabolism, driving up fracture risk. Okay, so it basically kind of inhibits osteoblast, that is the cells building new bone. Okay, so this will be kind of have a destructive mechanism when you're on steroids, but how you can still manage with right balance of food, and I think your activity levels, we will just kind of look in the further slides. And enhances urine loss of calcium via kidneys. Okay, so that's the reason taking your calcium supplement during this time is very, very essential. And it also decreases drastically your intestinal calcium absorption. So maintaining your prebiotic and probiotic on the foods is very important. And it also has an impact on your muscles and metabolism. Beyond bone loss, steroids change how nutrients are partitioned. That is, it causes muscle wasting, especially in the proximal limbs. So maintaining your fluid retention, it promotes fluid retention and raises the blood sugar, because steroid builds in the insulin resistance, because of which, okay, you will be developing in the raise in the blood sugar levels. So how do you balance your protein options and fiber options in the plate is very essential. And I think how to manage your fluid availability daily in your diet is very important. When you take less fluid, of course, dehydration sets in, and other medical conditions like acidity, okay, other concerns like acidity, gastric also can add up because of the changes that you have adopted along with the medication. And increases appetite, leading to rapid fat storage. Okay, this is a concern. But when you have an increased appetite, what are the best choice of food that you have to include? Don't randomly include refined foods. Okay, when you include refined foods, again, you're kind of suppressing your immunity even more. And it also reduces your insulin resistance, increases your insulin resistance some more, and because of which there will be a rapid fat storage, and that will kind of disturb your metabolism even more. So balancing your diet is very, very essential. So I'll just straight away go to a sample meal plan. Okay, like for example, most of the time we'll feel that in a vegetarian diet, how do I meet my calcium requirement of 1200 milligrams per day, and I think my vitamin D requirement, and this is 80-gram protein for a person who is around 90 plus kgs. Okay, so protein is distributed based on your height and weight. It is generally recommended if you are a normal healthy person between zero point 0.8 to 1 gram and you're physically active, then you can recommend so much. If you have any other medical conditions, the protein percentage has to be tapered down accordingly. But this is a sample meal plan just to show how you can still manage your calcium and protein requirement. It is not a typical meal plan that you have to be followed based on your medical condition. Always these has to be customized. So for example, if you're including a finger millet ragi porridge with cow's milk, okay, and added almonds to it, okay, easily in that particular meal, you got like around 15 grams of protein with a calcium of around 380 grams being a vegetarian. So the same way it goes for the lunch and evening snack and dinner. And same way you can observe for a non-vegetarian meal. Okay, generally you have the myth that I think once you are a diabetic or you're having high cholesterol, so okay, it is okay, you're not supposed to have the egg yolk. But only thing is you have to balance your saturated fat availability. Based on that, how many egg yolks you can have in a day, based on your activity, age, medical conditions, that can be decided. So this, for example, in the sample meal plan, we have just included one whole egg and two egg whites, okay, along with sauteed spinach and low fat dairy. So easily where you got around 22 grams of protein and a calcium of around 300 gram in one single meal. Okay. So how do you kind of balance your meal is very essential to kind of get your calcium and vitamin D and your protein, everything intact for the day. Now, best food combinations are very important for the absorption. Okay, so along with these steroids, doctor would have usually recommended you the vitamin D and calcium supplements. So, but vitamin D functions as the direct biochemical locking mechanism in your duodenum pair. High calcium meals like yogurt or paneer with vitamin D sources can help you to absorb the calcium intake better. So whenever you're kind of having a calcium supplement, a vitamin D supplement, make sure in that particular meal you're including a calcium and protein balanced food so that the vitamin D is absorbed better. And the next important thing, whenever you're having a vitamin D supplement, making sure you're having a healthy fat at the same time. Okay, so which are considered as healthy fats, like for example, avocado, egg yolk, nuts, and olive oil or ghee. These are very important fat soluble vitamins, so that it helps you to absorb the vitamin D supplement that you have taken better, because it stimulates your bile release, and it also boosts up your gut absorption, so that it is better and to be taken along with good fat, so that the absorption factor would be better. And do not take vitamin D supplements on empty stomach. And then talking about pairing magnesium with calcium is very essential, because magnesium activates your cellular enzymes that convert vitamin D into usable form. Ensure daily menus like which includes like pumpkin seeds, almonds, black beans, okay, to balance your calcium transport. And this also helps you to preserve your bone density. And these are generic informations, and it does not kind of expect you to follow straight away by listening to this discussions. Please do discuss with your treating doctor, and I think then accordingly change, if at all very any changes would be required on the pairing of the medications or the timings. Then talking about wrong food combinations to avoid, basically high oxalates with calcium. So oxalates, when they are highly available, especially found in raw spinach, not only spinach, all type of greens, I would say, it is highly available. So I think this time, these days, it has become a fancy or a immune mediating, or like I think, or a prebiotic drink. I've heard from many people that taking raw juices, be it I think greens or like ashgod juices, many of them they do consume, but it is very dangerous because the oxalate levels will be very very high when you take it raw. So make sure they are in the kind of sauteed or steamed mildly and then included. So when you do that, the oxalate level reduces, and then when the oxalate level is reduced, it binds better with the calcium, and it is good on your gut for absorption also. And then taking caffeine and soda whenever you're taking a calcium tablet, again, this does not make good sense. You're taking a supplement here or a calcium rich food here, but immediately you have a caffeine or a soda, okay, you're suppressing the absorption of that calcium rich food. So generally do not take them immediately after that particular meal. And I think in the previous slide we discussed about which are the calcium rich sources. So basically don't include like the meat, it can be nuts and seeds, greens, all these are rich sources of calcium, and egg also. Then calcium clubbing with iron at the same time. Again, this is not a good combination. When you directly have calcium and iron directly compete for the same receptor in the intestine, so the absorption can be inhibited. Taking a high dose of calcium alongside an iron supplement, okay, will block the absorption of the iron. So what happens in this condition, one medicine is acting and the other medicine is not acting properly. So in case, usually the doctor's advice also would be in the same way. They would have kind of given you the calcium dosage in the night, and I think iron supplements in the morning or in the afternoon. But for the ease or convenience of taking, sometimes, clients or patients would be kind of taking all the medications at once. But sometimes what happens, because of this, the absorption factor is hindered. So make sure you follow the prescription what is given by the doctor, like for the particular medicine, be it supplements or the other medications. Take it as per the doctor's advice. Yeah, at unavoidable or circumstances, or in case you suddenly forgot, in case you take like for a day or two, make sure you're not taking it at the same time, but take them 2 hours apart. But do discuss with your treating doctor about it. Then customizing your calcium intake or protein intake as per your age, gender, and profile is very essential. And in women, particularly in postmenopausal women, calcium has to be considered very, very important, because as we step into this postmenopausal field, what happens, the estrogen levels drastically stop, and it accelerates the bone resorption. So here, stepping up your calcium availability in your daily diet is very essential, and directly do not start your calcium supplements by yourself. please go by the doctor's prescription. And here another tip that I want to add on is, once you are into 45 plus or 50 plus, do get your DEXA scan done. Okay, because or menopausal, postmenopausal 5 to 7 years, make sure you get a DEXA scan done, because this gives you a clear visibility about your bone strength, okay, where you are and what needs to be done, what are the corrections needed. And this is like a best precaution that you would be following for yourself, because when you do the DEXA scan, you will be knowing the bone strength. Based on that, you will be able to adjust not only on your food availability of calcium, but I think the activity that you need to kind of plan after that, even that can be decided. Because I think just by including the calcium rich foods, you will not be able to build your bones or keep your bones stronger. But planning the right kind of activity along with that builds your muscle strength, and I think forms the bones also better. So it's important that how you will manage your levels after that. So please plan a DEXA scan, okay, and do not wait for symptoms to occur. Whenever you have any kind of aches and pains, deformation of bones, it is too late for you to see a corrective action that time. So I think once you step into any postmenopausal age, get the DEXA scan done, get a visibility of where you are, and I think accordingly modify your food habits and your lifestyle. Then talking about older adults aged 65 plus, again, aging reduces protein synthesis and natural gut acid also reduces. Because of this, again, the bone deterioration or the bone loss can happen. But in elderly, the other concern is they are having a low digestibility concerns also as they are stepping. So what they'll do, they'll reduce drastically on their protein availability in the meal. So if the protein synthesis, protein content is reduced, the muscle formation also will go down. Muscle synthesis also will go down. So in such elderly people, distributing your protein through the meal is very, very important. And even if you are resting, what is the protein required for your age is very important, because protein not only helps you to in muscle synthesis, but it also helps you to keep your immunity better, maintain your energy levels better. Absorption of more of your micronutrients is important. So do not neglect your protein as you are aging, but distributing them accordingly is very important. And when you're on steroids and you have the complications related to diabetes along with that, again, what happens is avoiding your simple and refined sugars and incorporating omega-3 fatty acids is very essential at this stage, because generally steroids brings in insulin resistance, and because of this insulin resistance you will be having a lot of craving for food sometime. But when you have this cravings, what are the right choice of food to be included at this stage is very, very essential. Every time you have a craving, instead of adding on to your micronutrient rich foods, you increase your macro, that is your carbohydrate source or your grain source in the food, you'll keep adding on to your weight. But already you are in a autoimmune condition, okay, where, okay, bearing the extra weight for your body will be a concern. And with the steroid medication, you increase your calorie availability in the meal, you will add on some more weight, and that will be an additional stress to your bones and muscles. So that's the reason. How do you kind of keep yourself better? How do you kind of resist yourself, or how do you plan your meal and your macros, inclusion of macros, and suppress your hunger? Okay, to know the healthy snacks choices, okay, do connect and get your proper diet plan, what should be taken during these conditions. Okay. And medically required bone supplements, this is very, very essential. So do not neglect your supplements which has been advised by your doctor whenever you've been taking your steroid medications. Even if you're good on the diet, do continue the supplements what's given by the doctor, because it prevents bone leaching. It's standardized delivery, that is, I think, improves your gut absorption, and it's a joint safety medication too. So don't stop taking them. And then talking about the dosage and timings, okay, this is again strictly to be followed by what your doctor has suggested. But as an information, I'm just giving here, calcium carbonate always should go strictly with the meals. And calcium citrate should be taken with or without food, but it does not require stomach acid to be broken down. And vitamin D3 should be taken with the largest fat containing meal, okay, such as your dairy or egg or after the dinner would be the suggestion. And spacing rules, making sure that calcium 2 to 4 hours apart from other medications. So whenever you're taking a calcium supplement, make sure you're not including any other supplement along with that. And basically, whenever you are on thyroid medications, okay, so make sure the thyroid and iron tablets are not taken when you are on along with the calcium tablets. Then managing your stress is very, very essential. So do make sure you, even it is like, I think in inward, it is not that you will be able to assess yourself whether you are having the stress or no. There will be an emotional stress, anxiety, and physical trauma. Sometimes, fear within, okay, why I started with this medicine, what is the reason. Sometimes you will be able to share it with your own family, and sometimes you might not share it, but you would be thinking deeply about it. So in such situations, what happens, it kind of disturbs your gut metabolism and it reduces your stomach acid, and that's the reason you will develop many other concerns. It could be like, I think, constipation, okay, many other concerns. So it's very important that you have a simple session with the psychologist so that you're able to handle your stress better. So you will understand why that particular steroid medication was given to you and how it is going to help you rather than harming you. Okay, so don't have that fear. In case if you are kind of having that fear, do approach the psychologist, take a session. And again, this word of you, I mean, they're meeting a psychologist. Many of us have a trauma that I think we have some kind of a mental illness. No, the moment you meet a psychologist, it does not mean that you have a mental illness, but obviously she will be kind of he or she will be giving you the guidance as to how to manage your stress. What are the things that you have to do on a daily basis to manage that? Okay. And this topic on bone health and nutrition was steroid nutrition was basically to give you the information that steroid is not a bad medicine. Okay, don't kind of treat it or have the fear that that medicine should not be taken, but do take the medicine as been as suggested by a doctor. The most important thing with steroid is never abruptly stop the medication. Go with the doctor advice. It has to be tapered slowly. During this time, the pointers that you have to take care is managing your nutrition, that is your balance of your macro and your micronutrients. And the next thing is exercise is very essential. What type of exercise, how much you need to do, and mental wellness, meditation, deep breathing exercises, that is also very important. And in case you have that inward stress, I think meeting a psychologist, just having one consultation with that is also very essential. And I would also want to add on that in Chandray, we have all this facility under one roof. If you're interested in enrolling in our sessions, you can kind of log on to this website, www.chandraycare.com. All the details are visible on the website, and you can, once you register yourself, our team will reach out to you and you can get enrolled. And this is basically about the lifestyle changes that you need to bring in along with the medications that you have started. So the support mechanism will give you a better and healthier life. So do not fear the medicine that you would be taking, but how do you manage yourself while taking the medications, keeping your health better is very, very important. And steroid does not kill you, but it is a good pain, I mean to say inflammation marker reduction it gives you, and it will also reduce your risk of many medical challenges if taken in the right way as per the doctor's advice. And if any queries, please do reach out to us on the contact numbers given in the next slide, and we can always support you. Thank you.